All right. Good morning, everybody. All right. So we'll get started here with sharing some of our data and trends. I'm hoping I can see from that far away. I may have to look over here just to make sure that I can see. So a couple stats for us looking year over year from 2021 to 2023. You can see that we remained in the same number of schools at 28 between 2022 and 2023. But our total number of students served did increase by 11.9%. Up to 895 total students that we were able to serve. Our number of new referrals was actually down a little bit. And I think part of that partially was due to the fact that we retained so many from the year before to continue doing services with us. And then the number of new clients enrolled was at 431. And then our client conversion rate was able to go up. So those that were getting referred, we were able to convert over into clients for us to see. Looking at the total visits month over month throughout the year, it's pretty interesting. You can see the trend based on the school year, right? So in August, start of the school year, it's a little low, but then builds up all the way to December for the holidays, where it does drop off a little bit. And then after the first of the year, we continue to ramp back up all the way to the summer months. What we are really proud of, though, is the fact that we were able to continue serving so many students through those summer months. So although it's lower, we still were able to really do a lot of good work with our clients, both on an individual basis and through a wide range of groups that we were able to offer all throughout the summer. Let's see, unique client served also follows that same trend across the school year. But again, those numbers are higher overall for us throughout 2023. And then enrolled per month, you can look as well there just to see the trends across the month that follow along with that school year. But again, through the summer, we had quite a bit there. Customer satisfaction scores, we were shooting to be above that 80% satisfaction rate, which you can see there. We were, with the exception of the month of June, but for that month, we only had one customer survey submitted. So we're continuing to focus on parent engagement, trying to get as many responses as we can from those surveys, just to make sure that we're getting quality services to both the children and their parents. Our outcomes, what we're trying to measure across all the services we provide, first off, is greater access to mental health services to the students. Referrals are generated from multiple sources, so from within the schools, based on the assessments of the clients that we see. Clients should be provided barrier-free access to services, with referrals turning into clients. So seeing that conversion rate go up is evidence there that we are serving more and converting those referrals into actual clients. Earlier detection of mental health needs of students, coupled with appropriate treatment being provided. And we're able to look then based on school records to determine how that's impacting attendance and things like that. And then the last one is that exceptional customer service, which we were measuring from those parent surveys to get the data to determine what their satisfaction rate is with the services that we're providing. Oh man, this one's going to be tough. I'd have to go quite a long way. So let's see. Oh, nice. I can do that. Much better. Much better. Thank you. All right. So for our strengths, all of our overall key performance indicators have improved. Our staff remains flexible, providing both in-person and telehealth sessions where needed. So over those holidays, breaks, things like that, we are able to continue services through telehealth. Our summer groups were received well, and we had a lot of great participation. So again, continuing to serve through the summer months through groups and initiatives like that. We were in the schools and seeing clients the first week of school this year. So rather than it being a ramp up period, we were able to hit the ground running and start seeing children as soon as the school year started. We had our longest period that we were fully staffed for all of our schools, so no vacancies throughout 2023, the lowest rate of that we've ever had, and we were fully staffed at the start of the school year. All of our on-site therapists completed assisting and managing suicide risk trainings. Our communication really improved on the school level and the district level in collaboration with them. We continue to collaborate with the school care team to increase our presence of support after a crisis. So that's something that really ramped up this year, is in those crisis type events that were happening on a school level, they would come to us and we were able to really step in and be a part of that care team to both assess and serve the clients following any kind of crisis. Again, a strength being the keeping the client engagement over school breaks. And then name recognition has improved in the community of North Fulton and in the schools as well. And then also more duties and responsibilities were given over 2023 to our school-based program manager for greater oversight and program stability. So having someone in that leadership role to really provide hands-on oversight and support for all of our clinicians that are in the schools. Opportunities, continued creativity around supporting school staff by way of school staff and parent support groups. Greater need for mental health supports due to the impact of COVID-19 over the past 3 years. And then opportunity, exploring the use of clinical interns in school-based settings and use for future employment opportunities. So we were able to put our first intern into a school as part of that initiative as well. Weaknesses, some things that we ran into. We had some early challenges with Wi-Fi connectivity, but this has greatly improved over the school year. Some challenges with office space in the schools impacting client sessions. So for some of our schools, we have a dedicated space and a dedicated area that's great to be able to work with clients. There are some limitations with that, so we're having to find space where it's available. This also leads to a limited capacity to grow because of the variable office space available in schools, especially if there's a shared office. So we're not able to put in another therapist or grow our services if the space is limited. Weakness, processing, gathering paperwork due to intakes being virtual and not in person. It's another challenge, just to make sure that all the paperwork is getting completed when they're not right there in front of us. Non-English speaking parents are harder to engage with. We do have the use of a language line and Spanish speaking staff that we're implementing, but that still is a challenge depending on the location there. So we have our intake paperwork in Spanish as well. And again, that language line as needed. The threats we see, so nationwide and statewide turnover in the social services field, across the field, that's something that I think we're all challenged with. Our need outweighs the capacity. So there's a greater need than we're able to provide just because of some of those limitations in space and that sort of thing. And then turnover and onboarding leads to disruptions in treatment. We've done much better with the turnover rate and filling all those roles. But again, that does, it can disrupt that whole treatment process when we're having to find a new therapist to put in place in a school. And then increase in secondary traumatic stress and burnout amongst clinical professionals. So this is, again, across the whole field, just with the levels of traumatic stress that we as clinicians experience and sitting with clients that have such high level mental health needs. It's tough to not carry that around with you. So burnout is a real thing and something that we're up against. And then lessons learned for 2023, just the power of teamwork, communication, and collaboration on the school level. I feel like both with that new leadership role that we put in and just kind of as a mindset, we've really been much more cooperative and collaborative with the schools, which has really been helpful. And then looking to work directly with the schools before escalating it to higher levels has really improved our relationships with the schools and our reputations in the schools as well. And then lessons learned, just being fully staffed and in the schools as soon as possible has been helpful and great. And the need is there. The fact that we can come in right off the bat, day one, and there's people that need services is pretty incredible. Looking at demographics real quick, in terms of ethnicity, again, large chunk was non-Hispanic, but we had 62 Hispanic and then 177 that did not specify. In terms of race, predominantly white, but again, American Indian, Asian, Black and African American at 85, 2 or more races at 49. Some of this is just it's related to the area population that we serve, right? But we are trying to serve as diverse of a population as we can. Age, you can see it's pretty even split across the age brackets, with a little bit more in that 14 to 18-year-old range. This is actually improved. Previously, the large chunk of our services were more in the 14 to 18-year-old range, and now we're serving much more on the lower grades as well. So from 5 to 10 years old, that 216, and then 11 to 13 at 204. You can see our gender distribution here is 50-50, which I think are right at 50-50, which is a good thing, right? So it's going against some of those stigmas around males seeking treatment because of gender norms and things like that. You can also see some of those other gender types of, non-binary, non-specified, or other. So serving those students and clients as well. The majority of our sessions were in person through 2023, but we did do 8% that were telehealth. And then in terms of household income, the largest chunk was above that $100,000 annual income, which again is largely due to that area that we serve. But on the other side of that, all of this is below that 100,000 threshold. So it's about half and half if you were to add up above and below 100,000. We were able to serve 51 clients that their annual income was 0 to 15,000. And kind of you can look as we go across the different income brackets there, a pretty good distribution of those that we served. So just a couple notable trends. We went, so total sessions in 2023 was up to 8,900 versus 6,700 in 2022 for a 32.8% increase. Some community outreach things to highlight. So we provided staff trainings on breaks, professional development days. So all county social workers and counselors and teaching staff at the school level we were able to provide training to them. We were able to host collaboratives on relevant community topics with professionals, and we attended all school open houses in August. Again, the staffing data, we're really proud to have it fully staffed. And then success stories. So Johns Creek High School, the diversity and therapists offered to engage clients and serve the needs of schools. We now have 2 females and 1 male in Johns Creek High School, 1 being Caucasian, 1 Hispanic, and 1 Black. So really trying to focus on diversity of our staffs in the school, being fully staffed and in the schools, like we said, some trainings that we provided on solution-focused brief therapy, and then increase in the number of students served over the summer for groups and individual. And that's all for us. And then I'll let Kathy share a little bit about anything she wants to share.
Didn't know this was coming. Yeah, I just wanted to talk a little bit about how we have been able to work both with Fulton County government and Fulton County schools to provide community engagement with parents through those collaborative events that we sponsor. We've had one on suicide awareness. This past year, we had one on social media and gaming and pornography, and how social media has impacted our students, and another one on substance abuse. We also, as Will alluded to, we have been doing a lot of trainings in the schools during their professional development days. We were able to do trainings with all the school counselors, social workers at levels elementary through high school.
Thank you so much, Summit. Thank you for your contribution to the Behavioral Health Network. Great work. Thank you all so much. Next up, we have Georgia Hope, who is our provider for children and adolescent services at our Oak Hill Child, Adolescent, and Family Center, to be named in the future as our Health and Human Services at Oak Hill.
Hi, everybody. My name is Capricia Webster. I'm the clinical supervisor and I'm a therapist here at Oak Hill. I am in a room full of big dogs. I hear directors, area vice presidents. So I'm just happy to be here and be able to share our data. For the sake of time, I will be, going through quickly and reviewing just these graphs. These are the services we offered in 2023. It was our first year, so we're starting with 0 clients and building up. So this time next year, there will be a lot more to present. With this first quarter, I want to go ahead and iterate here that this orange part we can omit because this is February. So I don't want to mislead by saying that that full bar is our total. So total clients served by the end was 38 clients. Again, starting at 0, by the end we had 38. And then we had 21 new ones going into that midway of the first quarter. So you'll see duplicated, non-duplicated, and those new ones. In person was all of our clients but one. We wanted to set a foundation. Talk therapy is more effective in person. And so we only had one client for each of those months that were telehealth. And you'll see that that grows as well. But by the end of first quarter, you'll see unique clients. We have 38. Okay. And so going into our second quarter, we will look at total visits. And so for April, you'll see that we had about 38 visits. And then you'll see a dip throughout in May. We noticed that once school was out, there was that trend of people trying to find their new schedules after school's letting out, family vacations, visiting family and such. And then you see that it picks back up in June as people settle into that summer schedule. And so if you look at that last column, that's our unique clients. And you see by the end of the second quarter, we've grown to 68 clients. Okay, going into the third quarter, you see that our visits shoot up to over 100 for July. You'll see another dip come August. Again, now we're transitioning back into school. That's a notice trend that people are settling back into that schedule and seeing how that will look. And you see that it picks back up in September once they're settled. As far as telehealth, you'll see now, as compared to first quarter, there is much more telehealth clients. After we've seen them in person enough and up to the therapist's discretion, the family, and the treatment goals, if telehealth suffices, we're able to provide that service a little bit more. And by the end of that quarter, we're a little short of 100. We're at 96. And fourth quarter, you will see this continued increase in our total client visits. As far as in-person and telehealth, they're not so much equaling out, but you'll see that there has been a growth in the telehealth services there, still as effective and clients still working towards those treatment goals. But when you see those telehealth visits, they're usually not all telehealth visits. It's more of a hybrid. And so clients will come in person one week and then they'll do a telehealth visit the next week. And then at the end, you'll see our caseload has grown. And so we are at 118, I believe, by the end of the fourth quarter, which is pretty good starting from 0. Okay. And as you can see with our discharges, the total of discharges we had at the end of the year was 48. And so you'll see that I did a breakdown of the reasons for our discharges. When you see that 16% in the orange, which is not much of the 48, but that's non-compliant. And so that just means that at Georgia Hope HCA, we do have a policy after 3 do not shows or after a consistency of canceling sessions. We realize that treatment goals we can't work towards those treatment goals until the client is actually engaged. And so we will discharge for non-compliance, but they're always welcome to say they want to enter again. We do an assessment, we start over. Some we've referred out to the lovely Chris 180. We've had to refer some to them if it's just more convenient or a higher level of care if they're needing IFE services or PRFT. And then the dropped out rate is our highest. And that's usually when clients are doing well with treatment goals and then they suddenly stop coming, or due to transportation barriers that we just can't help with, they say they're going to take a break and then plan to come back. And so you'll see that that's our highest rate as far as the dropped out. on this side, you can see the trend there. As far as noticeable or notable trends, we focus more on the clinical. We don't have a year to compare it to really see trends there, as this is our first year. So as far as clinical trends that we've noticed, a lot of our clients have ODD or ADHD, and we've noticed behavioral issues being the primary focus of treatment goals. And so because of that, we've taken even extra steps in our office to kind of help with that, down to the snacks, right? We don't even have certain snacks with red dye because we know that's proven to work against those with these diagnoses. And so another notable trend that we've seen is the need for parent training. We find it to be more helpful for the clients when everyone's engaged in their support network. I myself and another therapist are currently getting trained in PCIT, which is something that heavily involves the parents to be a part of, and it's a lot of coaching. We try to frame it in a way that parents don't hear parent training and think we're telling them they're not doing well as parents. But as far as their clients and them wanting to see those improvements, being engaged and having those family counseling sessions minimum once a month has really shown to help with the success of our clients meeting their treatment goals. And then as you saw in my graphs, that trend of it dropping at the end of school or when school began, that lower attendance there, just as they settle into schedules or figure out what's going to work best for them, we've noticed that trend. And so heading into 2024, we've learned to be creative so that we keep our attendance there. Doing the SWOT analysis, we've identified with our strengths that our census continues to grow every month. Being that this is our first year, we want there to be new clients every month. And we have seen that. Another thing is the positive feedback from clients and families. You'll see on another slide that we also do the customer satisfaction surveys. We get a lot of positive feedback from those, and it helps us to improve even more with client care. And then good internal communication, which has helped us not only within the building, but as far as the network in general. Good internal communication with the other providers, with Miss Africa, Miss Lynette. Those things have really helped us to keep things flowing in a good way and keep the census growing, and with referrals. Opportunities we've noticed is that we just have to continue with community outreach, making sure the community knows that we're there. A lot of them, when we first started, did not. And just getting our name out there. So there is some name recognition when we mention Oak Hill, that they can tie that back to counseling and family services. And just the increased need for services within our own community. A weakness we would say is location. Location is one of those where it could be a strength, an opportunity, a threat. It kind of goes in each box for different reasons. We put it in weakness because we've seen that our location has somewhat hindered some clients coming in, whether it be that the location that they're coming from, it's hard to get to at specific times, especially afternoon and evening due to traffic, but also us just being on that adjacent street of Cleveland Avenue and Metropolitan Southwest. We must account for the area and the activity that goes on there, and making sure that our clients are safe, especially those who don't have transportation and walk. We're going that extra mile to make sure that they're still able to come to their sessions. But that's why we put location in the weakness, something that we've already in 2024 have gotten creative with, used our resources. And so it necessarily might not be a weakness come this time next year. Limited availability, like Summit was talking about, like there's a high need, but capacity, right? And so there's only so many therapists that can give those sessions between 4 and 7. And we've combated that by, hiring more people. And so now heading into 2024, we do have that availability at that preference time. And we've also put therapists in schools to see their clients, or have the counselors set up laptops so that we can see them telehealth during school, just to break that barrier. And then threats. I could put location possibly as a threat, but I would say that it's just that societal stigma that continues around that need for counseling services. We see a lot of families that, they're kind of interested, but kind of 1 foot in, and we kind of encourage them to be engaged, and it ends up working out. But even if we have clients there, sometimes with families, it's like, okay, the client needs help, but, as a whole, we're good. And so it's that stigma around, like, no, the whole family can receive services, or we can do counseling for the parent or guardian. So just breaking down that stigma, which we all in this field know is there, that will continue to help. I won't go over all of our community outreach, and I didn't list them all, but these are some of the events that we've attended in order to get our name out there and let the community know we're there. Our biggest thing we've done is at the bottom, those walk-in Wednesdays where we put flyers everywhere and anyone can walk into Oak Hill to get the assessment. In that moment, as they're doing the assessment, we put them into our referral process. And then from there, they have a scheduled appointment for individual counseling. So it's kind of one of those one-stop shop things that really have helped us to get more referrals in. And we've done a lunch and learn for juvenile court. And that was helpful for those juvenile court referrals. And these are the customer service satisfaction surveys that I talked about. For certain months, none were turned in. And so we have done more paper copies this year to help us to, for every month, get something turned in. But when those surveys were submitted, our numbers were pretty good, the lowest being a 90%, which still meets that KPI standard. And then last, our success stories. On the surveys, there's an option for clients or families to add a comment. And so those first two bubbles are comments that have been on some surveys. One talking about one of our therapists, Akeisha. This was left by his guardian, and someone talking about being grateful for the services. But I also wanted to add, I even put one up there, but just a success story from therapists. I had a client, multiple aggressive outbursts at school, grades were not good, lack of motivation. And now he reports more positive emotions on a daily basis. He's had 0 outbursts at school, no detentions, no suspensions for the whole school year or even this school year. He's motivated. He's ready to get a job. We're constantly doing that resource linkage, trying to see what's out there for him, which is big. And when you think about these clients, these children that don't have a motivation or hope for the future, being able to work with those behavioral issues, but the motivation piece, being able to increase that, it can be life-changing for some. And like this, my therapist, Angel down here, she had a client who even the behavior was bad within her office, right? And now those meltdowns, that aggression, she doesn't see anymore. And again, for some, that's small, but when behavior is affecting a child's life and opportunities for them, to see a decrease in that is really big. So again, this time next year, we'll have notable trends to compare from last year and we'll have bigger numbers, but I appreciate you guys taking the time to listen to me today.
Thank you so much, Capricia. Great work Georgia Hope is doing at the Oak Hill Child and Adolescent Family Center. Next up, we have Chris 180, who is one of our child and adolescent providers as well, also serve our emerging adult population. They provide services at 2 of our locations, and we will have the ladies, I'm assuming, come up to the mic. It's a group. Okay, that's fine.
So again, I'm Jennifer Clark. I'm the clinical director for 2 of the counseling centers in Fulton. So that includes the center at Adamsville and the North Annex. And we've had a leadership change. My operations manager and I have both been with the team for about 6 months. And so we're learning our staff, we're learning our strengths and our challenges. It's been a really, really good experience. I'm putting notes on my phone because I can't see. And so clients served, we've had 200 at North Fulton, 656 individual unique clients served at Adamsville, and altogether 856. Our demographics are next. So one of the things that's interesting about the team is that it's my understanding that they've gone from completely telehealth services to meeting clients in person last year. And so moving them and moving clients into different expectations for what they'll be doing as therapists and what our clients need has been a big shift. But so Adamsville, the primary population is African American, and North, it's about 50% African American and 31 other races. Not sure how that qualifies in there, but it's a definite different demographic at each center, and it's different challenges and different abilities that we can reach the community at each center, but they have their own feels, and so it's been interesting. So I'm moving on to discharges. Adamsville's had 326 discharge clients, 79 at North Fulton. The majority of clients dropped out of service. We have a similar policy to Georgia Hope. If they have 2 no-shows, if they don't respond to a letter that we send saying, hey, do you want services? Are you going to do this? Or if they're canceling a lot and not engaged. So that was our heaviest. And then other reasons were the next level. Some were referred out. We have been sharing resources with Oak Hill, and we're excited to continue to be able to do that and partner with Georgia Hope. See, the next one talks about total therapist sessions provided each month. North Fulton's itty bitty, but we're growing. And Adamsville, we have the most staff and the most clients, and we're working on building up North as well. Also at Adamsville, we have psychiatric services set up and running and going. At North, that's something that we're starting to implement and get on a consistent basis. We get to partner with Morehouse University, and they allow us to train some of their students. Let's see, type of services provided. The slide is not showing up on my phone. Oh, I can do new. That makes sense. New clients enrolled each month. It's been today. Okay. Telehealth versus in person. So, sorry, I'm back to, yes, please. Okay. So most of our services are still being provided telehealth. We're trying to shift that. It's important that we shift that. I think it's harder for clients to engage whenever we do telehealth, especially very young clients with ADHD diagnosis. And so we're working on building in person. We've been graced with a beautiful play therapy room at Adamsville. And so we're encouraging our team to develop their play therapy skills and be prepared to meet those clients in person at the site. Customer satisfaction surveys. So it sounds like it's a theme. Trying to get people to respond is a challenge. So we're building up how many we send out. Parent engagement. It's also a theme. We're trying to get that. We're doing specific things to try to engage families, which I think is going to increase our responses to satisfaction surveys. I want family therapy has been implemented, and we're trying to do family trainings, and we want those parents to buy into this, or it's not going to help their kiddos, because things have to change at home before they'll change for the child. And I think everyone here appreciates that. No-show rates, Adamsville, and then the North Fulton Annex. Most of the appointments attend. I'm kind of surprised that our no-show rates are, that's great. So is this it looks like we put it. So I think North is on that one and this one. Okay. Community outreach, empowering young men, youth conference, Fulton network kickoff event, silence the shame event, and community outreach, other community outreach events. My staff step up and sign up for those. It's an exciting chance for us. Trends in service. We already discussed moving from telehealth to in-person. Service provision has shifted. Majority telehealth, concerns about convenience and access being prioritized over clinical necessity. And we really want that to move so that we recognize that it's meeting what our clients' needs are, not what is more convenient for us. And working with parents to encourage them to participate, because yes, I'm sure that it's easier for families to stay at home and do the sessions, but that 5-year-old who's bouncing around the room and not focusing on telehealth is really not probably getting the best services that he's going to. We've noticed that client engagement corresponds with the school calendar. Obviously holidays, everything dips during school breaks. So we're trying to find ways to keep it going through the breaks and I think, again, the key to that is parental engagement. And we're returning to this family systems approach instead of just focusing on the client, focusing on care for the whole family. We have who our leaders are. This is the staffing data for us. We have a full house of therapists at North now. We've been trying to do that since I started, so I'm excited about that. So there are success stories. There is more than one. I love it because when we meet for our weekly meetings with my team members, they share with me how their clients are doing well, or they're engaged, or this kiddo had this. Now, when I ask them, hey, can you write that up and put that in a thing? No, silence, crickets. But Mary Kay came through and shared a story of a 9-year-old who was really acting out. He was really reactive. The longer he's been in therapy, the calmer he's being, even at school, in all of the different places where he's at. So that's a great story. Next year, I'm going to work on building that skill of storytelling and getting more stories for that. So for our SWOT analysis, our strengths include that we have the connection to the larger CRIS 180 network. We have all kinds of services that CRIS 180 provides, and we get to participate in that. We also, I like that we're also focusing on referrals with Grady because we share our space at at North. And so that's exciting. We're getting referrals from Grady. We're talking to them about adult clients. We are also part of the CCBHC system now. And so that gives us access to funding for clients who maybe have no insurance or who have private insurance, and there are clinicians that are not credentialed for that particular insurance. And it's providing a lot of space for clients that we didn't have before. We have well-trained therapists with diverse licensure. We've got family therapists, we've got social workers, and we have LPCs. We have flexibility in services because we work late. We work into the evening if we need to. We can be there early if we need to. So those are some of our strengths. Weaknesses: difficulties in keeping clients engaged when changes occur. And that's not just changes with the clients, that's changes with us. We've had a threat is high staff turnover. And so keeping those clients engaged if they have to change a therapist, or if it's a third time they've had to change a therapist, and trying to build that rapport. And so some of that is just addressed by meeting expectations at the beginning. Hey, welcome to therapy with us. We're a core provider. This is one of the things that tends to happen. A weakness is how we've been processing managing change for clients. So we want to be able to support them, encourage them, be proactive without discouraging. Because sometimes when clinicians get frustrated, that can be communicated to the clients, and we don't want that to happen. And then the high rate of staff turnover, which I like to think is industry-wide and not just specific to my sites, but as we build rapport with the new teams, we're certainly seeing some changes in staff. Opportunities: actively recruit clinicians with interest in serving high-need clients, under-resourced populations. I have noticed, and I'm sure others of you have noticed, that since the pandemic, the higher need clients, or there's higher need clients, there's more of them. Maybe we're doing better education about mental health and what the needs are, but there's definitely more people who are stressed and upset and dealing with substance use. And so that's another place that we're working on, is developing and strengthening our substance use services for adolescents at both sites. We want to improve onboarding and training processes. There's so many trainings. It's like going into a candy shop or a bookstore. You go to the training site. Very exciting. So encouraging staff to get all their trainings and get everything lined up. Strengthening communications across stakeholders and management. So again, starting to talk with Grady and working with the ladies with Fulton County and getting our organization together and our communications solidified with 2 new managers on these teams. That's been a little bit of a challenge, but we're doing it, and it's and we will continue to do that. I'm very excited about that. More populations, more services, more integrated care through CCBHC. Threats, The demand for services way outstrips staff capacity, and we have limited office space at both facilities. We're kind of in the midst of, okay, if you do, it's one of those little sliding puzzles, you know? Okay, so if you're here Tuesday and I'll be here Wednesday. So that is the end of my part. Now for school days.
All right, good morning. I am going to follow my colleague Will's footsteps because my eyes, but I'm Brittany Walters. I'm privileged to be the Vice President of School-Based Mental Health at Chris 180. We are proud to be partnered with 81 schools in the Metro Atlanta area, and 38 of those schools are a part of the Fulton County Behavioral Health Network. Just like Summit, we too have been a part of the Fulton County partnership since about 2019, I believe. And then we had the privilege of partnering with Summit from 2020 to 2022. And now we're both individual partners still working side by side to get this incredible work done. So today, what we're going to focus on is our 2023 data. For our 38 schools, we served 1,223 individual students. 520 of those were returning from the previous year, and 703 were new this school year, or I'm sorry, in 2023. We had 703 new referrals, and of those, 593 were enrolled. Our client conversion rate has increased to 84.5%, which we're really proud of, because a few years ago, it was closer to about 59%. So we're really, really proud of that improvement. We provided almost 20,000 therapeutic sessions, just under 20,000, which means for our students, if we took an average, and of course, this is just a sample, that would be about 16 sessions per student. Now, we know some might have been engaged for the entire year, others might have had just 3, but if we take that total number, it's about 16, which means our average length of time in treatment was about 4.5 months. So here's how you can see the breakdown of sessions by month. Just like Summit articulated very well, it follows this nice seasonal curve. We see it dip down way low over the summer, though we do our best to keep our students engaged. We were able to provide close to 1,200 sessions in June and July, which is pretty impressive given the population that we serve. And then it comes back up nicely in the beginning, back down for holidays and so on. One of the biggest things that we're proud of at Chris 180 is across our programs, we utilize the mantra of no wrong door. So whether you call the wrong program or you call a program that's not in your area, we really have focused on centralized intake to make sure not only kids get connected to the school, the community, the center, the program that they need to be connected to that's most therapeutic for them, but also we don't say no. So if we can bill insurance, that's great, but we utilize funding from a variety of places to make sure that we can start treatment immediately, regardless of insurance or their documentation status. So this year in 2023, sorry, can you go back? 9,975 sessions were provided completely at no cost to the client as a result of our partnership with Fulton County. That is a little over 50% this year. Last year, it was closer to about 48% of our total. So we've always hovered in that 50-50 insurance versus uninsured or at no cost. But that totaled over $1 million, which is about the total sum of our contract with Fulton County. So that is what these dollars are going toward. They're going completely right back into the students that need it most. Here is how that broke down by payer. You can see again, predominantly Medicaid and CMO with 56%. We have a very small population of private insurance that we can bill. So many of those no-cost services are actually students that are privately insured. I call them the forgotten middle, because a lot of times people think that, oh, this child has Blue Cross and Blue Shield, this child has Aetna, they have resources. And often those families are still under the poverty line, and the barrier is that they can't pay that $25 copay. So we actually cover that cost and would still see them at no cost. So the 2.5% is only the percentage of kids that we have, you know, the stars have aligned where I have a therapist that's also paneled, fully licensed with blonde hair, blue eyes, you know, all this different criteria in that zip code that can serve that kiddo.
But if I was going to make a guesstimate of the 50% of services that we provide at no cost, about 20% of them actually do have private insurance. We just either can't bill it due to paneling restrictions, or they can't afford those copays. So we provide that service at no cost. And then again, 41.5 uninsured. All right, so race and ethnicity, you can see predominantly, one of the best things about our partnership with Summit was that we really complemented each other, and we could always see this nice kind of yin and yang based on the populations and zip codes that we serve. So our predominant race is Black or African American, with our lowest being not specified. And multiracial, we have really increased the amount of Spanish-speaking families or of Spanish descent. We also have a growing Asian population in some of our schools at 3%, where historically it was about 1%. All right, so here's how our ages break down. Once again, a nice compliment to Summit. Our largest bracket is ages 5 through 12, and then a close second with 13 to 17. And then of course, our high schoolers 18 and up, only 7%. And gender, we are also on track with Summit. We are about 50-50 split this year, with 49% male and 50% female, with only 1% identifying as other. This was a new data point that I thought was interesting just for stakeholders in Fulton County to see the zip codes that are predominantly served for us. So of course, if you really want to take a look, you have lots of zip codes down here, but the top 5 are listed on our left. One of the other things that we're really proud of as a school-based provider, we have learned over the years that seeing the individual students and breaking down the barriers and being able to see them in class and not have the parent be stressed about transportation is fabulous. But for a school of 1,000 kids, that's great for those 21 children that are on that caseload. What happens to the other 919 or whatever that comes out to be? One of the things that we've really committed to over the past several years is maximizing the impact of that one therapist or part-time therapist or 2 therapists, depending on the school, in that community. So really taking a look at the entire school as our client, that yes, we can serve a caseload of maybe 25 to 30 children that need the services the most. But what we also do is provide school-wide initiatives that can encompass more psychoeducation and skill building for students that don't have to technically be enrolled as a client. So this has been an incredible initiative over the past several years. And post-pandemic especially, we're seeing that with stigma and capacity and all those post-pandemic trends that people have spoken about, the groups have been a great way to capture people either in the school or also with teacher training. So this year, we provided 235 student groups serving about 5,800 additional students, which is pretty incredible. We did 42 parent groups or parent events, and were able to reach over 5,000 parents, and 27 individualized teacher trainings, reaching 1,326 professionals. So our focus is really, if we can treat Johnny and Ashley and Cindy in the class, that's great. But what if we can teach Miss Smith how to better structure her classroom with trauma-informed principles, routines, and rituals to impact positively all 22 children? That's really our goal. Here are our client satisfaction survey results. That is a mouthful. Similar to our colleagues, we were able to remain above the 80% threshold, with the exception of April, when we only had, I think, 1 submitted. And in January, unfortunately, we hadn't yet gotten started. So we're proud of the results when we get them, but like everybody else, we're always working on engagement. We have this year gotten creative to put up QR codes. We've passed out little cards for our high schoolers. We have a good idea for everybody in the room. Our therapists have a link to the survey in their signature. How am I doing? Let Fulton County know. So really trying to get creative to get as many surveys as possible. All right, so here is our staffing org chart for anybody who is interested. One of the things that we're really proud of is we did restructure our school-based division in the summer of 2023 to provide more infrastructure and more leadership. So we now have a director of Fulton County who oversees the clinical program managers who work with all of this individual therapists in schools. All right, so for our success story portion, we took a little bit of a different approach, and we wanted to talk with you guys today about a really specialized initiative that we do at Chris 180 called Peace Corners. These are not things that are funded through our partnership with Fulton County, but they are funded through alternative funding streams that we go after because we think it's really important. And this is one of the ways that we treat the entire client and as our, the entire school as our client and try to maximize our impact. So Peace Corners have been proven to really help schools and classrooms keep kids in the class as opposed to out of classroom discipline. So what happens, especially in younger classrooms, is they learn to self-regulate, they learn to proactively take a break. The teacher has more resources and they don't have to just give all of their individualized attention to one child if there's a tantrum or a behavioral concern. And so these have been really, really helpful. You can see a couple of variations and they look different, whether you're working with little ones, middle schoolers, or high schoolers. Sometimes we've done truly a corner in an identified classroom. Other schools have said, we have this whole room. Can we make it a Zen room? We're also really proud. These are all in Fulton County. But one of the things we just did last month was our very first Peace Corner for teachers. And we're really, really excited about that. So more to come on that, hopefully in 2024, but that will be a new initiative for us. All right, for our SWOT analysis, I'm going to step just here. Sorry, David. Some of our strengths have already been mentioned by other colleagues, but certainly more rhythmic collaboration with our Fulton County school partners, as well as our other on-site partners. I think our on-site meetings have become more and more productive as time has ensued. We contract with a private company called Voice to really break down the language barrier, which has led us to increase our ability to serve Spanish and other language speaking families. First Day Fulton, we always have a large day presence there, as well as other community outreach, certainly the Silence the Shame event and other things with Commissioner Natalie Hall. And then we had a higher client conversion rate from referral to intake this year, something I mentioned earlier that we're really proud of. Weaknesses, our friends at Summit did mention, we struggle with Wi-Fi and connectivity, and we all are in an electronic health record, so that can really prove to be difficult sometimes, as well as printing, scanning, access. This improves, and then we have bugs, and then we have hacks, and you know how it goes, but that is a real challenge for us. For opportunities, we are constantly updating our trauma-informed training opportunities for schools to take advantage of each year. We provide them with like a menu of sorts of all of our off-the-shelf trainings that we just have ready to go. All of our staff are also trained in how to deliver that content, and we're always updating it. So several schools have said this menu is great, but what we really need is a training on ABC. And we'll say, okay, well, we'll develop it. You know, give me a month. Let's get it on the calendar. Chris 180, in addition to what Jennifer shared about our CCBHC status, which we're very excited about, we are also transitioning to a new electronic health record that is world renowned for providing outcomes. Right now, we have great quantitative data, but our current system doesn't provide the best qualitative data or outcome-based data. So in 2024, we're really, really excited about that transition, and we're well on our way there. And for threats, Summit mentioned nationwide and statewide turnover, need outweighs capacity. Turnover and onboarding for us leads to disruption in treatment. And the other thing that we've seen is increased level 3 threats. So Chris 180 outside of the Behavioral Health Network has a separate partnership with Fulton County Schools to provide on-site level 3 threat assessments at the school for all 102 Fulton County schools within 60 minutes. And the way that the schools qualify a level 3 threat is that it's a threat to violence to the entire school community, like a school shooting or a school bombing, or a homicidal targeted threat towards somebody in the school and more than likely to occur on campus. So we've intercepted loaded guns, we've intercepted knives, we have been called because there was a bomb threat, somebody said that they had a bomb in their backpack. I mean, all of these different things. And so in our community and in our nation, we know that school shootings have been on the rise in America. And I'm really proud to be a part of Fulton County And it's hard to measure prevention, but we have intercepted several and prevented several instances of school violence in 2023. So that is it for school-based mental health. And I'm going to transition quickly to text for help, which will be a much more condensed. But Text for Help, for those that don't know, is one of the services with the Behavioral Health Network in Fulton County that provides 24/7 access for any Fulton County student to text when they, you guessed it, need help. So here is how our conversations broke down by quarter, with our Q1 having the most at 55. Students can reach out for anything. So we get everything from I need help with study skills, I'm feeling anxious, to I think I'm pregnant. Really, it is an open door for them to be linked with a licensed professional on the other line. Here's how it broke down over the month. So we definitely, it still follows that same school-based curve. Our highest month were November, where the holidays started, and also February. So some interesting trends there. By weekday, we see the highest in that middle of the week on Wednesday. However, Saturday creeps up there too on the weekends. We'll talk about time of day in a minute, but it is interesting, this really nice bell curve here that we see. So for start time, this is in military time, so I apologize, but 13 is right here about in the middle. This is 1 p.m. So you can see the majority of our sessions occur between, the afternoon and the evening, but we also have some early morning and some really, really early morning that wake me up out of bed. So I will say we do get some in that, 2 a.m. to 6 a.m. period where kids can't sleep. They're at a party, their designated driver is drunk, they don't have a way home. Lots of issues occurring early in the morning or late at night. Here is just some data about approximately how long the conversations last. So you might have been thinking, oh, there were only 55 students in all of Q1 that reached out, which doesn't seem like a lot. But remember, these are more often than not crises. They're usually not calling for lower level issues. I mean, some do, but 55 is still a lot. And you can see we have a lot of conversations that last anywhere from 15 to 50 minutes, and even some that go over a couple of hours. So often they're only a few minutes, it's resource, it's a linkage to a partner in the Fulton County Behavioral Health Network. One thing to know is it is confidential, it's not anonymous. That was a switch we made a few years ago to make sure that we could report situations of imminent threat. So we do have access to the phone number if needed, if we need to give that to law enforcement. That is a last resort, but we have that as a safety blanket. But predominantly it's anonymous. So sometimes they'll say, yes, I want a therapist. No, I won't give you my name. Sometimes they'll say, my name is Brittany Walters. I go to Westlake High School and I would love a therapist. And then we can make a really seamless transition to an on-site partner. We've done that several times with Summit and others that are partners in the school. I know the font is small, but here is some data about the most common presenting problems. Often they will reach out to test the system and they'll say, I just wanted to make sure this number works. So you'll see a high amount of no response or testing the system in the beginning, which I actually don't mind because they're saving in their phone and they're saving it for when they need it. So we're always like, I'm so glad you reached out. Yes, save this number. Absolutely. But then really we see depression, romantic relationships, stress, and family conflict and self-harm on kind of like the top 6 or 7. So an interesting data point that we're able to collect through the platform is if they're repeat texters. We have a lot of kids that are repeat texters, which tells me that they got something that they needed at a previous time when they reached out. We also have about the same amount that are new texters. And then there are several that the system isn't able to tell. So that could be they got a new phone number. That could be maybe they said something in their text that said maybe that they had reached out before, but it's unclear. So some interesting data there. And was the school contacted? This year we had more school contacts. Like I mentioned, the post-pandemic trends that we've noticed in schools have definitely included an increase in threats of and actual violence on school grounds. So we have actually made more reports this year to schools to alert them than in any other year, with a total of 11. And you can see the schools here listed that we let them know. Sometimes it's that a teacher did something that the student is complaining about, and we're alerting the district to that. Other times it's that they heard about a situation with another student potentially having a weapon on campus. It can really vary in degree, but we did have 11 situations this year that we escalated up to the school. And here, actually this year, we didn't have any instances in contacting the police. We've only had to do that a handful of times in the past several years. And that was really, really, really imminent risk to where we were worried for that person's life. So this year we had none of those, which is really great. And then treatment connections, I mentioned, one of the best parts about being a part of this behavioral health network, as we know, is we can lean on one another. So we have been able to make seamless connections, 9 total, to therapy on site when they're able to provide that information. And that's been a blessing for many of our kids. And SWATs. We had 0% turnover on the clinical professional team that run the 24/7 line. So we're really proud of that. I mentioned we shifted from anonymous to confidential because of those real times of emergency or danger. We didn't want, God forbid, something terrible to happen and us say, well, they reached out, but we had no way to get them. So now we do have that safety blanket to be able to relay that information if needed. And Lynette will appreciate this. We are partnered with a third-party vendor who builds the platform and helps us with our data. And like anything, everybody's human and systems have glitches. So over the past few years, we've had to really perfect, does Chris 180's numbers line up with your numbers? 2023 was the first year we had 0 discrepancy rate. So we are really excited. Our data is accurate. A weakness, we did see an underutilization this year, and it's kind of hard to determine why that is. Maybe it could be because we went from anonymous to confidential and they know that we could report in the event of a real emergency. It could be lack of awareness, although Fulton County Schools has really increased the efforts to get the phone number out. But we did see more of an underutilization where in past years we've seen steady growth. For opportunities, definitely some new marketing strategies for Fulton County Schools to push the service out. Several teachers tested the service this year, which was a first for us. We had about 4 or 5 teachers reach out saying, I'm burned out, I'm stressed out, I'm depressed. And so that's a conversation we're having around, could this be beneficial for Fulton County teachers also, or how do we really respond? We have been able to link those individuals with adult services if they're interested, but that was definitely something new we saw in 2023. And for threats, we really didn't identify any outside of the underutilization of service. We're cooking with gas, and we're really excited to continue to support our students in those times of real need.
Thank you so much,
All right.
Brittany. So informative. Just for our Zoom participants, we are going to take a quick pause. We are running close to the end of our time. However, we want to ensure that we share all of the information, the great work that the providers are doing. We are recording this session and it will be available on our YouTube, right? On our YouTube channel. We will also try to upload it onto our behavioral health website so that you can go back and review the presentation if you're not able to stay on after 1 o'clock. We're going to take a quick pause just so that our partners here can grab them some lunch, and then we will be right back in about 4 to 5 minutes. Thank you. Right, so if you guys want to go ahead and get some lunch, and I do apologize. As I said, we are recording this session. You will be able to have the opportunity to come back and watch it at your convenience. We are going to jump right back in, continuing with our child and adolescent and emerging adult programs, and then we will transition directly into our adult services.
Good afternoon, everyone. Again, my name is Jessica Hayward. I'm the program manager at Fulton County Clubhouse for Youth. We are actually starting with our enrolled per month. I pretty much looked at our status, and we usually use Georgia State portal. And so we got all of our information, our stats throughout the year. So we kind of service unique client service in 2023 is 43 clients. In 2022, we actually serviced 16. So we had a tremendous jump in 2023 due to us really going forth in marketing Clubhouse at all of our Fulton County schools, to our juvenile justice here. And so kind of starting with our demographics, we actually have serviced 13 to 15 years old at our highest. 15 to 17 clients have been served. Primarily our males are our highest gender that we service, but we also service females. And then when it comes to race ethnicity, our population is African American. And so going into referral sources of youth serves, these are kind of where our community outreach is happening, but most of our resources do come from probation officers as well as the school. Move on to the next slide. And so looking at discharge clients, as stated from everyone else, a lot of our clients did not make contact or voluntarily withdrew from services or detained from DJJ. Currently, we're working on our goals completed, but in the process of that, they are working toward increasing, which going back to program goals, we have our 6 deliverables, which is starting with decreased substance use. We administer our drug screens, which is 116. Our clients who tested negative was 48 out of that 116. And then we do provide substance use and relapse prevention education. We provided 302 hours within that year. And then our second goal is always to decrease DJJ involvement. Here we have a new admission involved with DJJ when they first come in with 17 clients. For those kids that are within our program, new involvement with incidences with DJJ was only 3. Here, our other goals that we try to focus on is decreasing behavioral problems. With this, we focus on teaching personal goals, life skills, nutrition education, stress management, anger management, and health-related education. We were able to provide over 1,201 units provided. And then we also focus on increasing social and family involvement, where we're recreation, community, social outings, employment, but we also provide family outings and parent education. And we were able to do 543 hours of that. And then we also focus on improving academic performance, basically focusing on education such as school visits, GED, or tutoring within the clubhouse. And we were able to provide 160 hours of units. Here's basically our staff data. We did have our program director, Rowan, today's his last day with us, but I just wanted to highlight him because he's been a huge part of the clubhouse, as well as myself. We do have our administrator and everyone else, our case manager, our therapist, as well as our certified peer specialist. And then obviously our customer satisfaction scores 95%. We did miss some, but the way we've been working on is giving paper copies to our youth and our parents, which has actually helped a lot. And then our SWOT analysis. I'm not going to read everything, but overall, our strengths is kind of focusing on dedicated and fully staffed. We have face-to-face family interactions. We focus on increasing referrals with DJJ and courts. We do a lot of fun outings with our kids, such as Six Flags and a pumpkin patch. And then we do have a client retention. The kids do come every day. And then our weaknesses, I would say vehicle maintenance. We have to kind of make sure our vehicles are up to date because we do provide transportation. Supervision on the vans, because we have at least 5 to 6 kids in the van. We have 1 staff that can drive due to only having 5 of us in office. Staff turnover, the camaraderie as challenges of EHR systems, conflicting with documentation. We had change of EHR work in a working progress and trying to keep up with our documentation. And then low referrals count each month. We're trying to find ways to increase our referrals, and that's kind of a weakness right now. Opportunities, I would say new leadership, as even though Rowan will be transitioning out of Clubhouse, we'll be getting a new director soon. We will have increasing community relationship with providers, referral resources, and community programs, increasing opportunities, diversity, engagement, and inclusion of cultural events. So we're going out to different opportunities within the community. We are increasing marketing with director presentations, school and social workers, school-based services we've done, as well as actually going out to the Fulton County libraries and YMCA. And we also have more population, which is the CCBHC funders as well. And then our threats, I would say, would need to be pretty much the lack of useful security. We do have a security that comes in, but we're still trying to make sure it's more consistent. Transportation. So again, we service all of Fulton County, so it can be a little struggle trying to get all of our kids due to Atlanta traffic, as well as all of our kids getting out of school at the same time. So that has been a huge weakness, but also a threat, because we don't want to leave a kid out in the school by themselves. We do have cleanliness. Just Fulton County has worked really hard with us trying to maintain that, as well as pest control and just staff burnout. Okay. And the last thing I did want to mention about our summary, our success stories, was we had 2 youth graduate from our program who actually got accepted into 4 colleges, and she actually struggled with anxiety the most. So she really had a huge impact, and she's now in our aftercare program. And then we also have 2 parents who actually reported being able to find jobs through our program.
Awesome. Awesome. So now we will have our reentry services presented for emerging adults, and then we will transition directly into our adult reentry services presented by Women on the Rise.
Yes, this is the last program for Chris 180. I'm going to try to be as concise as possible, okay? So hi, everyone. My name is Helen Johannes. I'm the VP of Prevention and Stability Initiatives, and I get to work with the wonderful team at Chris 180's Reentry. We have Imani Holly, who actually manages and oversees the day-to-day operations, and she is joined with 2 case managers. Both are Michael Audrick and Michael Stafford. We are a small but mighty team, and I am the newbie. I joined in the later half of 2023, and I'm just very proud of the work we're doing. Reentry in a nutshell, what we do is we provide services to individuals up to 24. We try to help them successfully transition from incarceration to community post-release. All right. Yes. So 2023, we've had 140 clients assessed, and we've had 40 participants successfully enroll into reentry. This is a completely voluntary community-based program. Sometimes we have folks that do decline reentry services. Sometimes we have folks that do not meet eligibility criteria due to their charges. And in some cases, we've had minors that we weren't able to attain consent for them to participate. I'm not going to read everything on the slide, just key highlights so we can move over. Next slide, please. Per quarter for 2023, we have an average of 10 enrollees participate in reentry, totaling to 40 unique clients served. We primarily do see males. We've served 134 males this past year and 6 women. Our primary population do identify as African-American with 87% and 13% other races. And then 15% of our program participants obtained their high school diploma. We have tons of key performance indicators. So on that slide, you do see 11. I'm just going to highlight a few. Our indicators, we track percentage of clients that are connected to community mental health services. Our goal for 2023 was 80%, and our actual was 100%. Our percentage of clients receiving the GAINS assessment within 24 hours of being referred to reentry, our goal was 90%. Our actuals was 93%. And our percentage of clients that are not rearrested while in our program, our goal was 80%, but our actual was 85%. So we're very proud of those measures and those goals. Next slide, please. Okay, so we do provide telehealth and in-person services. In this past year, we were able to conduct 270 visits face-to-face for incarcerated clients, and we were able to conduct 260 visits face-to-face for released clients. We do see that we have more success when we also make collateral contacts, either with a family member or legal support or a community resource. And so on that slide, you can see a lot of our contacts with collateral. Discharges in the past, oops, sorry, back one slide. Discharges for 2023, 16 clients were discharged while incarcerated in Fulton County Jail, and 22 clients were discharged post-release. Next slide, please. Our average for customer satisfaction scores are 95%. We have had a wonderful average. However, there have been a few months in 2023 where we did not receive those surveys. So our goal moving forward is to increase engagement and really get more surveys completed by our participants. SWOT analysis. That is a lot of words on the slide. So I'm going to highlight a few of them, okay? Our strengths, we engage many referrals within that first 24 hours, which is very important. We maintain a 95% customer service satisfaction rate. This past year, we developed our first very detailed manual that consists of all of our policies and operating procedures. And we have also increased training for staff to improve documentation within our program. I'm going to talk about some of our opportunities. Our opportunity is always, how do we be more creative with engaging clients? When they are released from jail, sometimes it can be hard to maintain that engagement. They're transient, they're getting stabilized, and many times they may not have a cell phone. So we're just working, how do we increase communication and engagement? How do we strengthen skills in operating our customer service? How do we develop incentives as participants reach milestones throughout their time in program? And also through our CCBHC, which stands for Certified Community Behavioral Health Center. Took me a while to remember that acronym. We are going to be able to service more population and provide more services. Threats. We do try to move away from telehealth services because face-to-face is effective, but we fear that by moving away from telehealth, we may create a barrier for those clients who strictly prefer telehealth. So we're working through that. Another threat that we experience is sometimes just the general and continuous stigma around mental health, which can sometimes discourage clients from enrolling in fear of having to wait on mental health court. Next slide, please. These are some of our trends that we've observed in 2023. Clients are more likely to participate in services if we have collateral context. So when we get buy-in from families, we do see more successes. Most clients are not released from jail with a working cell phone, as I've mentioned, so communication can be a bit challenging at times, but we do try to meet that need. And also we've observed a significant reduction in wait times for Fulton County since the 2020 pandemic. Some of the aftercare services we provide, so post-release, 22 clients successfully connected to full-time employment. We've provided 270 face-to-face contacts with clients. 37 out of our 40 participants were connected to housing resources, increasing their stability, and 100% of our enrolled clients are connected to mental health resources post-release. And here is one of our success stories that we just wanted to highlight. RB, one of our 22-year-old participants, he's been very active in service. We were able to connect him to housing resources post-release. He's met with our case manager, Michael Audrick. Frequently and weekly, we've been able to connect him with mental health and employment resources. And he is now working with our community partner at Goodwill in a training certification program to become a forklift operator. And as you know, when you have good employment and stable income, that increases your stability and also reduces your chances of rearresting or recidivism. So that wraps our reentry program. Thank you all for your patience and listening.
Thank you. Child and Adolescent Services, Emerging Adult, you guys are doing an excellent job as partners within the Behavioral Health Network. So thank you so much for your partnership. Thank you for your commitment to the citizens of Fulton County. And now we will transition to Women on the Rise, who is providing reentry services through the Behavioral Health Network.
Good afternoon. So Women on the Rise, what we do is we service women that are inside of Atlanta City Detention Center that reach the age of 25 and older. Our aim is to connect justice impacted women with identifying mental health services needed to resources to stabilize their mental health. We also work with women who have substance abuse issues as well. We assign case managers who go inside the jail and actually meet with them. We do our gains assessment. We figure out their needs. We figure out their housing. We figure out how to connect them with their families and see sort of like build that connection with them. One thing about us that make Women on the Rise different is that all of the women with Women on the Rise are impacted women. So when we do go inside and we speak to the women inside, we can say, we've been on that other side of the glass. We understand what you're going through. And it builds a form of trust. So when we tell them what they'll go through when they go to court, we build relationships with their public defenders. And so we're actually building a relationship of getting a whole team that's able to help them once they are released. The goals of the program is to interrupt the cycle of recidivism. What we're doing is we're trying to give them a purpose. We're trying to help them identify the reasons of why they were incarcerated. We increase the support to enhance reentry recovery goals. So we work out a plan for them, a recovery plan. So when they get out, that they know that they have things that we need to help them achieve. We decrease recidivism and criminal justice involvement by providing a holistic approach to reentry. And what we mean by that is that we also offer a lot of mental health services to women. We just started doing a group circle where everybody gets to share their stories, and everyone is sort of like a sister group where we're helping each other. This data right here, I do want to say this is our first year, was last year of 2023. So this was the first full year that we've had. So a lot of the women, we got the 190 referrals, but we had 55 that declined. I think a lot when we found out from the declining was simply because they didn't know who we are. They just thought it was just another program. They want to come in there and learn about their business, ask them all these personal questions. So when we actually went into the jail, we talked to the ladies. We were able to go to different pods and that's inside the jail and say, hey, this is who we are. We got a lot of self-referrals through that. We got a lot of people that's reaching out to their families, talking about who Women on the Rise is. So what happened is then we got calls from families. So that's how we got families involved. We had 30 that were released early before we can actually get to see them. Our goal is to see someone within 24 to 48 hours. So it's really difficult when we have clients that are released and as well as in jail. So our goal is the 24 to 48 hours. But we also know a lot of times people don't even make it from Rice Street over to ACDC, and therefore that's how we lose a lot of them. Well, they go ahead and get, bailed out. We had 57 that were ineligible. Ineligible just basically mean that they had warrants, which we've actually worked that out now with Georgia Justice Project, where we will actually accept them now. And so they can actually work on getting those warrants and hold release from other counties, or people that didn't meet the age requirements, or we have a lot that did not want to admit that they had mental health. And then, but a lot, I will say a lot, I don't have a mental health issue, or I don't have a substance abuse issue, or I'm not ready to address it. But I think a lot of things of what we saw is when the people that we were going to see, once they go back and say, Women on the Rise gave me this thing to work out my anger. They gave me a thing to I can reunite with my children. So we give them things when we go to the jail. So we're not just talking to them, asking what's going on. We're actually giving them tools while they're inside, since they have the time to actually focus on themselves. And then that's when they'll come to us the next time and say, so-and-so said they declined, but they want to talk to you. So that's what we're doing to get people to be more interested in the program as well. We had 72 that actually were enrolled into the program and 588 consumer contacts. And connection to service, we had 148 connections through mental health services, housing, benefits, food, clothing, transportation, education, and employment. Everyone who comes out, if they do not need housing, we do get them connected with those families. If they do need housing, we provide 60 days of housing to them. But during that time, we pick them up, we take them to go get mental health appointments. We take them, if they need to fill out for Social Security benefits, we take them as well. And then also with Women on the Rise, we have a program that we have membership based. So we invite them to those programs as well. So they're not only working on themselves, but they're looking at a bigger community of other impacted women. So they see that they're not alone. When we start storytelling, they'll see, open up about their stories. When they see, oh, it's somebody else, somebody else going through what I'm going through, or they look at, see how I came from homelessness and how I came from incarceration. And it's like, I know if you did it, I can do it. So we share that story to make them open up a whole lot more. And then we had 51 completed surveys with a 99.3 satisfaction rating. And what we also have is 2 success stories. We have while navigating multiple medical appointments and new medical diagnosis, AS was able to gain employment that allowed her to meet all of her monthly bills. Through this stability, she has been able to strengthen her relationships with family and friends to create a supportive network. I will mention about AS, we had a very difficult time with her because when she was referred to us, we didn't know that she had other medical issues that was going on with her. So we weren't prepared for that, but we had to really put the work in with her. And this month being March of 2024 makes a year for her. So we're very proud of how far she's come. And then with the reentry support, VB has maintained stable housing on her own, and this has given her the opportunity to reunite and rebuild relationships with her children and her grandchildren. We just had a Women History Month event this past Saturday where VB was actually able to come with her children. And what we did there is we talked about how far women have come, things we used to couldn't be able to do, things we now can do, how much further we need to go for women's rights. But this person was able to show up. We did the makeup, we did the photo shoot, just to make them feel good about themselves and to see themselves as, you know, normal people instead of someone that's been incarcerated. So she was able to come to that event, share that with us, take pictures with her children, and she really expressed her gratitude of just being able to be in a space with women who understood what she's been through and not judging her from her past. That's it. Thank you.
Really quickly before we transition to our next presenter, I want to say we will have a reentry resource fair for Second Chance Awareness Month, and that will be on April 16th. And so we will email out flyers to everyone so that you can have that information. Next up is Step Up on Second.
Good afternoon. My name is Melissa Graves. At some point, I might need to walk closer to that. I like some of the others who I feel like my contacts are old, but I work at Step Up on Second, and this is our first year as part of the Fulton County Behavioral Health Network. And we provide permanent supportive housing so that individuals who have experienced homelessness for at least a year and also have a disability. We have staff on site at these two apartment complexes currently that consist of a case manager and a master's level therapist. So what we do is they become our clients the day they move in. So the day they move into housing, that's when they become, and then we assess them to see what level of need they have, whether it's their mental health needs or their life skill needs. We have served 49, 50 people so far between the two apartment complexes. Entrada has 25 units and Thrive Suite Auburn has 23. It's not here, but I do have it in my brain. Our population is about 85% African American, 15% Caucasian, and then our age ranges, our youngest individual is 20 and our oldest is 78. And with that wide array, there's a wide array of needs that the individuals have. So sometimes it's getting your GED, but some also have like complex health needs and connecting them to doctors. And with Thrive Suite Auburn, we're literally like a quarter mile from Grady. So sometimes we'll walk with the client to get to their medical appointments, and our staff are on site. And so they're always there in their support for both the client and the property management. We first enrolled people in, I think this is May, and this is the portion of I Will Walk Closer. Yes. So we enrolled less people than we originally thought because these were brand new properties that didn't come online yet. So that's where you see our enrollments increasing every month. And by August, both properties were online. And by December, we had 49 people in our program. So far, we've had 3 people discharged, and they were discharged because they were evicted from the property. So we didn't kick them out. They had lease violations, evictions, and that's why I hate to have my back to people, so I'll kind of go here. But 2, we were able to reunite with family members or friends, and 1 person we were not able to discharge to a permanent housing solution. Trends in service provision. So we often help people, those that want job skill training, we connect them to the job skill training. I heard Goodwill, Strive, we use those organizations. And also we helped our clients find jobs. And you can see here that it started off low because remember, we didn't have that many people enrolled. And so as it went up, we were able to get people connected to SNAP benefits, Medicaid, and SSI and SSDI. Progression towards KPI. I'm actually going to start with the second one first. So what we found is when people come in the program, connect them to mental health services right away. Because when you connect them to services right away, you see 52%, our goal was to have 50% enrolled. We had 52% enrolled. That first line is people connected at any point in time. And if we waited longer, they were less likely to actually engage in services. And I would like to point out that connected means not that we made the referral, but then they started services at that organization. So although we refer practically everyone, we can't control how many actually go to the appointment, follow through, and start services. And then these are percentage of clients with an identified substance use concern that have a treatment goal related to their substance use in the first 30 days. We were at 83%. And then those that we have connected with substance use treatment within 6 months is at 83%. I'm very proud of those numbers. I will say that you can have any disability and be in this program. So it doesn't have to be a mental health. It could be a physical health. It could be a developmental disability. But we have had more people that are dual diagnosis with substance use and mental health, and getting them to decide that they want treatment is a big accomplishment. And I see you shaking your head because you know how hard it is to get people to agree. Percentage of clients connected to community resources is 87%, because a lot of people on their own, they haven't been able to be connected to the resources that they need. But with our help, 87% of our members are. And then percentage of clients not arrested while in the program is 95%, which is not 100, but close. And then the percentage of clients who didn't reduce their service level. So I want to explain what that means. We assess people in the beginning. So there's a mental health assessment. So we look at your mental health needs, and you're either like high, medium, or low. And there's a case management life skill assessment in your high, medium, or low. So there's different levels of services you have based on their need. And ideally, we would reduce people's levels every 6 months they're in the program. We didn't quite meet the goal there, but I like the way my program manager framed it. She's like, we were just really good at assessing them, and they were at the right level. And that's why they didn't decrease, because we accurately assessed their needs. I was like, I like that reframe. Next slide. Customer satisfaction surveys. So we did good most months except for 2. And then once we talked to our staff about it, we were able to, for a lot of them, in one of our buildings, there's like really bad internet phone reception. So we had to do it on paper, give it to the staff to fill it out. And then that helped us increase our numbers of surveys completed. Okay, success stories. EM, he came to his appointment to fill out an application for this apartment complex. He actually came from the jail, so he was in shackles. And that's important because for the property management, they were like, what are we getting ourselves into? Like, who is this person coming into our program? And he would come downstairs every morning and roam in the lobby, talk, go up to random people, and he made a lot of people very uncomfortable. And we always had conversations about this gentleman, but we can say now that we've been in his life and we've helped him, and he has a roof over his head, and he's connected to mental health services, and he's getting what he needs, he's a very different person now. And also, I also want to add, he also had a health condition. He had pain in his foot for years that no one actually helped him with. And that's something else that we've done. Although for us and for the apartment complex, we can see the difference in him as a model resident and just his affect and how he engages with people. He's most grateful for that his foot doesn't hurt anymore. And we were able to help him with that very simple but very important part of his life. He laughs, and I'm telling you, you would not have thought this would happen when he first came into our program. So it's a great success. And then this other individual was homeless for many years. And this year he was able to host Thanksgiving dinner at his house, and his family come to his house. So that is a great accomplishment. See, that first time in over a decade. So I will take that applause. Thank you. Thank you. But it's just the success of, being able to have a roof over your head and using that housing first model, that you don't have to be in treatment, you don't have to be clean. We're going to give you a roof over your head and give you the support you need. And then that will help you change your life. Next slide. Maybe. Okay. That's hard to read from the side. So I'm going to come back a little again. What I really like about this model is that, like I said, the staff are on site. And so when things happen, we can address them in the moment and not have to wait till the next day. And that's a level of support that you can't do if we weren't right there. Our staff had to do stuff from help people clean up, to let me show you how to clean your apartment, to let me, like I said, walk with you to your doctor's appointment. And the success of the model is that they are there. Let's see, which that I didn't talk about already. That we also have a team approach, that is just not one person working with them, because you may be my case manager. I don't really want to talk to you, but I like the therapist more. So I'll talk to them, and that we can kind of tag team in our work with our clients. A weakness, I would say, a big one, is that property management is not ready for who we serve. They're like, yeah, we weren't expecting this. We wanted to help, but we wanted them to be better than this. Clean, we wanted them to be cleaner. We wanted them to not be disruptive. And so half of our work isn't just dealing with the client, it's the property and advocating and changing expectation. It's a lot of work. When I'm there, the staff, the property management staff are coming in talking to you just as much as the clients are coming in and talking to you. And there's a lot of stigma around mental illness. There's a lot of stigma around homelessness. And I always say this is a population, adults that are mentally ill and homeless, they're scary, they're uncomfortable. And so that's just one of the challenges we have. And I would say of the 49 units we currently have, there's only one that's a 2-bedroom apartment. So most of the units that have come online are 1-bedrooms or studios. So we aren't able to help as many families as we would like. We haven't had as much staff turnover. We've had some. What's been hard is we work with certified peer specialists who are the case managers in finding people who want to do this job. And if they're trained to do it, no, I don't want to do that. I want to work part-time, and this is a full-time position. So that was a challenge that we were able to overcome by making getting a grant for Fulton County. So can we hire people who are case managers and not necessarily that lived experience of being a peer specialist? And that has helped address that weakness. Opportunities, I think we could do, I didn't mention, we do weekly groups. So we can really cater the groups to what the need is at each property. And our groups could be anything from, how to find the love of your life, right? To how to manage your money, to, I think once we had help people getting a cell phone. So everybody can come to the groups. And we would like to be able to do more training for property management so that they recognize mental health and the substance abuse, and they maybe mental health first aid or some kind of training to help them understand the population that they will be serving. And threats, there are not a lot of treatment options for people that are co-occurring. They just aren't. And so sometimes we just have to decide which need is most significant, and that's the one we make the referral to for the clients. And then, as I said, we're serving an older population. So some have more complex health needs, and they need more than what we can do. Like, they need a live-in aid. They need something more than this, but there's not a lot out there. And so we try to refer for what's needed, but it would be helpful if there were more out there. We have 2 properties coming online in the next month or 2, and those are both 55 plus. So we know we're going to have an older population and that we will likely have more of these issues come up. And lastly, a threat is our members who are addicted to substances and the behaviors that accompany addiction. So what I mean by that is often it's not necessarily our members themselves why they get evicted, but sometimes the company they keep and the behavior of your company that leads to a lease violation, repeated lease violation. So that is one of the weaknesses. And thank you for your time. Whoever's next up on the mic.
Thank you. Next up is River Edge.
Good afternoon. As I said earlier, I'm Cass Hatcher, the CEO of River Edge. First, before we get started, I want to thank Latrina and her team for putting on this. And we've been partners for almost 6 years now. We started back in 2018, and right now we provide key services. We provide the core behavioral health services. We provide permanent supportive housing and services in the judicial system. Dr. Ali Allah is our czar for Fulton County, and he's basically oversees that for us at River Edge. But boots on the ground is Ms. Frederica Myers. She is the one who's there 24/7 and is doing an outstanding job to provide the services. Hope the data that you see today is informative, and I hope that we are doing a good job for you. And that's what we're here for, to help make life better for everyone. So Dr. Ali, go ahead.
Good afternoon again. We feel like senior citizens working for Fulton County now, right? I think we came in with Chris 180 about the same time. So we're the two senior citizens here. Thank you for indulging with us today. I'm going to go over the slides but what we have over 80 slides because of the number of programs that we serve. And the good news is I'm not going to stand here and go through all the 80 slides. So because I was told we had 10 minutes and I had planned for 10 minutes, and coming to find out everybody had more than 10 minutes. So, so what I've done is I've kind of created a summary of what we do in the first maybe 10, 15 slides. We're not going to go through the details, so I'm not going to hold you on. So with that, what you'll be looking at is our overall 2023 data and demographics for 2023. And what you are looking at here, we have served a total of 1,516 unique clients, which is huge for the programs that we encounter. And it goes from call services, which is our biggest service we provide, to MMC. So we have 1,224 unique clients in call services, which again, Frederica is in charge of. We have 43 MMC, RTC, which used to be DUI program. It's 86. We have mental health class program. We have only 6 there, and that's from Ms. Lynette's program. We have AHA, these are the housing areas now. So this is the Atlanta housing, 65, we have permanent supportive housing, 75, and Delvignium, we have 17, and that adds up to the total of 1,516 unique clients in 2023, which is huge. So what you're looking at is, this is the clients served in call services. Now you see that in Q4, it started decrease, it decreased a little bit when you look at the in-person services. And what happened is that we slowly transitioned from telehealth services to in-person services. And as you all know, when you go through that, the number attended actually decreases. But what we are doing to fix that, the mitigation strategies over there, is that we now have a transportation service within us. So we are able to go and pick up clients and bring them. And so that going into the rest of the years, you will see an improvement in the in-person visits as we decrease the telehealth. Like it's been said earlier here, clients tend to be more focused in person than they do in telehealth. So we are giving them a better service through in-person than telehealth. And that's why we are slowly going to decrease them on telehealth, increase the in-person, and go on. Now, what you're looking at is, these are the unduplicated clients throughout the whole program. Again, like I said, in Q1, we started at 809. And as of this year, we have 1,224. Again, this is the slide that I talked about earlier. This is just laying it out by quarter. Next slide. This is our admissions for core services. Like you see, it started at 99, but as of today, or I mean, it started Q1 at 118. It seems to be decreasing a little bit, but again, like I said, we are changing our services. We are providing transportation, so we expect this to actually get better in the coming years. Now, what you're looking at, this is a dashboard of core services. I'm not going to go through all of it, but what I've done is, in the interest of the 10 minutes I was told, I have put all the key performance indicators in a slide. It's showing the genders that we serve, the demographics like in race, marital status, all that information is in this one graph here. In the details, all these were broken down into the different services. So I just put this here so that you just see a dashboard, of what all the core services that we provide. This is core services, but the main programs that we do in core services. Next slide. So this is more looking at the core services numbers for 2023. And as you can see, this breaks down to how the referrals come in. We have self at the top, 119 for 2023. And then it goes down all the way to school, personal care homes. These are the numbers of all the referrals that we get, that total to what the number you saw earlier. Now, these are our discharge analysis. Again, this is all core services. If you look at it, it starts from dropped out of service, and then it goes on to relocated. And as you can see, treatment completed is the biggest we have, and we are very proud of that, because we want to discharge them because they have actually finished their program, because that is what we are there for. So we are glad to see that number rise in 2023, and we hope to continue with that into 2024 and the rest of the program years. Now, this is BHA in 2 days. As you can see, we are totally 100% there, Q1 through Q4. We are proud of that as well. And this is again for core services. This is prescriber in 14 days, CHR 100%. This is GCAR referral appointments in 1 day. These are all requirements in our KPI. And again, here we are 100%. This is no-show rate for non-medical. As you can see, Q4, it went up a little bit, but for the most part, I mean, comparatively, for the most part, we've stayed very low on these numbers. This is no-show rate for initial psychiatric appointments. As you can see, this is Q1 through Q4. And Q4, we stayed steady except for Q2. Q2, we went up slightly. And to be honest with you, I'm not sure why, but I'm sure Farika can tell us why if you're interested in knowing. Thank you. Now, this is the no-show analysis. Again, it tells you details as to why it happened that way. Now, appointment canceled by team. This is by the clinical teams. As you can see, Q4 very low in 2023. Q3, it went up a little bit higher, and so was Q1. But for the most part, we are really very low in that area. Now, this is telehealth services. As you can see, as Q4 approached, the telehealth services went down, like I said earlier, because our goal is to transition from telehealth to face-to-face. And as of Q4 in 2023, we are at 91% for face-to-face. Again, in 2024, this number will even go down further as we reduce Q4. And again, as we reduce telehealth, and like I said, we're also providing transportation, so that will help to bring clients to the site. And this is the staffing pattern. All of us face the same issue, so I'm not even going to concentrate on that. I think everybody's pretty much said the same thing, but so far what I would say is that we have staffed quite well now. Turnover is very low, and we are really proud of the services that Forica is providing. Again, this is the SWOT analysis for us for what do you call it, core services. I'm not going to go through all this and tell you, but what I will say is that for core services in particular, one thing that we benefit from, our strength, is we have very good name recognition, because again, like I said, we've been there for 6 years now. Everybody knows who River Edge is, and we have other various services that is all on that list here. I'm not going to go through. Now, our weakness still remains, we operate out of Macon. You know, I'm not going to be shy to say that. Now, however, I will say that over the years, we have decentralized the management from Macon. And Forica has a lot of autonomy to make decisions now in Fulton, and that has helped us out quite a bit. So let's go on to the next slide. Again, this continues with the opportunities and threats. I would say with the threats, we all face the issue of finding what do you call it, qualified, certified behavioral health providers, nurses, and all that, you know, which all of us in this room face. Let's go on to the next slide. So now I'm going to move on to the specialty program, starting first with MMC. Let's go to the next slide. MMC is the Misdemeanor Mental Health Court. And these are our numbers. This is the unique clients, individuals seen in 2023 was 67. Individuals accepted to be, what do you call it, contacted with 7 new clients. We had 27 new clients, and then we have unique clients served 43. So the 67 you are seeing are clients who were part of 2022 who went on into 2023. Okay. Now, these are the clients served over in 2023. As you can see, the numbers started rising steadily. In December of 2023, it went down by just 1 client, but overall, it showed that we are increasing services in MMC over the years. Now, this is MMC by demographics, starting from gender and race. Of course, most of who we see in MMC, majority of them are male. The race, majority of them is Black African American. The age group that we see the most are the 18 to 24 years. And then, of course, the education level is mostly, what's that? That's high school. Some high school diploma. So in MMC, these are generally the demographics that we see in MMC. Now, this is in-person versus telehealth. Again, this is the same thing we've said earlier. In 2023, the telehealth started to diminish as the in-person increased. And we look for this trend to actually continue as we, you know, totally try to diminish telehealth. And these are the client concerns that we face mostly in MMC. Mostly it starts from, I think the largest is financial, and comes down to, you know, some don't even have any concerns, but we know they do because they are with us, but they just didn't voice it. This is client needs data for MMC. Again, I'm not going to go through all these details, but the largest, as you can see, is the one in the middle is employment. Because I think it's mostly also because of the stigma associated with mental health. It's hard for them to get employment, and which we all understand here. The services, as you can see, the biggest service concerns are the housing. I mean, services connections, sorry. The connections that we do, the biggest has been housing at 22%, which is about 48. Now, the good thing with this is this also ties into the PSH that we have, the permanent supportive housing. So it's a complete wraparound service that we provide. These are the behavioral health service connections. As you can see, majority, almost 70% come to the CHR services for behavioral health services. So again, it feeds into our services at CHR. which has helped our numbers tremendously. And this is the referral sources that we have from DUI, MMC, all these are all the referral sources that we get for MMC services. And these are the discharges for MMC. As you can see, third quarter, we had the largest discharge. Again, anytime this number is large, we like that because it means that they went through the program and they did what they are supposed to do. This is the customer service, the customer satisfaction scores for MMC. And as you can see, it's stayed steady for the most part. We've had a few lows. And December, we didn't receive any scores in December. Otherwise, as you can see, a few of the months we didn't receive any. But for the most part, we've stayed above 80%, except for maybe June. Success story, I'm not going to go through that, all of that, but we have had some very good success stories. And this is the notable trends in service. In 2023, high need for zero and low income housing, participants have limited support or network. These are all the trends that we see with the clients in MMC programs. So knowing these trends, we work very diligently to try to address them. This is the SWOT, again, for MMC. It's a lot over there. I'm not going to go through all of it, but just so you know that we continue to offer very good services, as you can see in the discharge and the people completing services. And staffing, so far we have had a very, finally have a good steady director who has been on there since 2023, Charles Glover, right? And he's done very well, and we're glad to have him. This is DUI. And again, this is the total served. As you can see, we served 86 total unique clients served. And of that, 43 are new clients, 24 for North Annex, because we still operate a DUI in North Annex, and 19 at CHR, which is our Boulevard location. Again, this is the total clients served, going back to the slide you saw earlier. By month, this is in-person versus telehealth. As you can see, telehealth, we're looking forward to that continuing to decline over the years. Now, this is treatment completion in 2003. As you can see, the graduation rate is really very high. So that means that they are adhering to the program we're giving them. They like it. They continue to come and do very well at it. And this is the customer satisfaction score. As you can see, very, very good. We still hover around the 80% average throughout the whole 2023. And this is the success story for MMC. Again, I'm not going to read through it. Sorry. For DUI, we've had so many MMC meetings that I think our court just goes to MMC, but please pardon me, this is DUI. These are the key performance indicators and how we met them. And we can just go on to the next slide. Again, just like MNC, these are the trends that we've noticed in DUI. Now they call it RTC, which is recovery treatment court. Okay. And this is the SWOT analysis. And again, I'm not going to go through all of it. And let's go to housing, because that's a big one. That's a big one. Now, as you can see, we started with, in January, we had 54 in permanent supportive housing, 70 in Atlanta housing, and 11 in Delvignia. Now, as you can see, the number went down a lot, especially in the Atlanta housing voucher for various reasons. Majority of them just lost their vouchers. And so that's how that number has gone down from 70 to 55, as you see in December of 2023. But the others pretty much remain the same.
So may I just add really quick on the Atlanta housing vouchers? I think it's imperative that we highlight that that was a result of COVID. So during 2020, when COVID was impacting all of us, We collaborated with the city of Atlanta to transition individuals into hotels that were at risk of being exposed to COVID. And then there was actually a hotel for individuals that tested positive for COVID. So in response to the hoteling, we partnered to get the Atlanta housing vouchers to transition those individuals into housing. And thankfully, our partnership with River Edge led us to where we were able to provide them with support with the Atlanta housing voucher. So I just wanted to add that little
Well,
piece in
thank
because I
you.
think that was very important to
Very
highlight.
much.
Mhm.
Thank you. So, and this is the level of service, the case manager level of service. As you can see, the largest was, pretty much minimal all the way to moderate intensive. This is the level of services that our case managers were involved in the PSH program. As you can see, mostly minimal was the largest we have. And then this is service level coordination as well. As you can see again, that's moderate because most of these folks are able to maintain services on their own. Okay. Next. Again, this is the care coordination as well. As you can see, majority of that, again, is still moderate. So most of the clients we have in our housing really just require moderate to minimal services. This is Dalvignia, and again, similar, mostly minimal to moderate. This is showing the PSH housing maintained over the year in 2023. As you can see, the number really looks good and it continues, it trends up all the way through December 2023, and we expect that trend to continue through 2024. And this is Atlanta Housing Authority housing maintained as well. And like Latrina said, you see that started high and it kind of went down through December, and that's like what we just explained earlier. And this is Dalvignia. That has mostly maintained it, the housing has maintained almost steady, just with a few drop, as you can see, between October and September, October, and then you look at December, November, December, it's just one only. And that is also very good. And this is some additional data, just like did earlier with the previous, just some, what do you call it, a dashboard type, one screenshot where you can see what's going on in our PSH program. And this is our success stories. We've had very, very good success stories. And I think Africa here will collaborate with us on that. We've done, it's been a challenge, but we've done well over the years. And again, this is our staffing pattern. I'm glad to say we have some very good staff right now in PSH. We've had a director and we've had a supervisor, who have done very well in our PSH program. And this is the SWOT analysis. Again, very similar story. I'm not going to go through each one of them. Now this takes us to Lynette's program, Class MAI. And as you can see, for this year, Q1 we had 6, and Q4 we had 1. And the next slide will tell us why that is so. Is because of the referrals. We haven't had as much referrals as we would like to. In Q1 we had 3 and only 1 enrolled. In Q2 we had 1, 0 enrolled. In Q3 we had 3, 0, and in Q4 we had 2 and 0 enrolled. So really, we have been trying very hard in that area, but it's just the referrals have not been coming in like the way we would like to. And these are strengths and weaknesses in Class MAI. Now, these are the lessons learned over the years. Again, like I said, some of us feel like we're senior citizens in Fulton County now. What we have learned is we need to continue to learn to promote services through Fulton County branch. This took us a while to really master, but I think we have it mastered now. We're also involving, involving Fulton County leadership with outreach. Like we went to the Lutheran Church, we have Fulton County with us. So anytime we go to any outreach now, we make sure somebody in Fulton County leadership is with us to try to continue with the branding and also the language, because we don't go to meetings with the rest of you, but they do. So they know how to make it all unique and universal for each one of us. And then of course, regular communication with our judicial partners and enhanced community resource mapping. And what that means is that we're able to look at areas and know which areas are our services are mostly needed. And this is because we have the van that we can send to these areas to bring our clients in to our services. And of course, we continue to actively recruit for positions, because things like nursing and licensed clinical services are continuous openings. Anytime you go to our website, there's always an opening for those positions, because it's a continuous turnover. And that's it for River Edge.
Thank you very much, River Edge. Next up, we have Grady. I just want to take note of the time. We do have a hard stop at 2 where we will be placed out of this room. And we have Grady and we still have Pat that needs to present today. Thank you both.
No problem. Good afternoon, everybody. My name is Rhea Maskell. I am the Behavioral Health Manager for Adult Care Services. I will also be presenting on the SRO unit, or the Screening and Reentry unit as well. So the Screening and Reentry unit, or SRU, the goal is to serve as an early detection to identify mental health concerns with inmates in the Fulton County jails. So the unit completes the GAIN, or the Global Appraisal of Individual Needs, on 100% of citizens that may score a 5 or higher on the CMHS. The goal is to complete the GAIN of surveys within 72 hours of booking. Okay, so this is just some data out of the total of 468 gains that were completed. 100% was completed within the 72-hour time frame, and it breaks down within 48, 82%, 69% in 24 hours. Of the referrals made, 165 were for emerging adults 18 to 24, and 166 were women of 25 years and older. So we're going to jump into core. So there are 2 clinics, North Fulton, which is in the Sandy Springs area, and South Fulton, which is in the College Park area. So those 2 clinics in core services serve adults who are 18 years and older with a severe persistent mental illness. Currently, these were our hours for 2023. I do have good news, they're slightly changing. So starting next month for North Fulton, we will be in the building a little bit later, so the staff will be there till about 6 on Tuesdays, just to open up that barrier. When it comes to services that we provide, I won't go through the whole list, but we do provide individual therapy, family therapy. We run groups 5 days a week, and we assist with crisis intervention, behavioral health assessments, and those type of things. So this is just a breakdown of demographic. So for the North Fulton clinic this year, and also I will preface, this is our first year within the network. We're glad to be here. So we were able to serve 327 individuals, and it goes into the demographics, male and female. So the females, if I'm not mistaken, I'll probably have to walk down. It's a little small. Okay. So for females, it's 62% and males are 38%. Just as far when it comes to race demographics, Black and African-American are our highest at 60.34%, our Asian population at 2.95%, and multiracials at 0.42%. South Fulton, our female population is 57%, where our males are at 43%. They're almost neck and neck. For our overall race demographics, our African-American population is about 90%, Asian 0.67%, and white or Caucasian 4.22%. And age demographics, you don't have to go back. We service at both clinics. I think our youngest client may be 18 and our oldest is about 79. So that's at both clinics, just across the spectrum. So for our KPIs, I'll just touch on a few of them. So we're supposed to serve 1220 for the year. We did 632 for our first year. As far as connecting providers to a licensed professional within 2 business days, this is an average of both North and South Fulton clinics together. I'm sure if we broke it up, the numbers would be slightly different between both clinics, but we were at 79%, so we fell under 1%. A part of that issue was when we first started, I didn't have any staff. We started with 1 clinician, but we have grown the team since then. Percentage of clients is 80% for the first year. Again, this is an average of both clinics. If we separated, it'd probably be a little bit different, but we were at 42.25. A part of this is also didn't have any staff, so we had to use various providers from within the network, within the Grady's health system to supplement until we had those providers onboarded. Okay. So this is notable trends for South, but I'll speak to both to save some time. So North and South, when looking at South, traditionally, we use a lot of different depression scales. So we use the PHQ-9. So you'll see where at least 40% of those patients that came in had a decrease. No change or increase is a variable due to multiple things. Most people, when they come into outpatient services, it is a buy into the program and a buy into their treatment. As you know, with depression, it is fluctuating. So it does take some time to start to see some true change in that. A lot of things that attribute to that for some patients could be, which we've seen a lot of, is a loss of housing or just loss of employment while being enrolled in services. We can go to the next 2 slides. Oh, outreach. Okay. So outreach, I'll just be quick on this. We did participate in a lot of the Fulton County Behavioral Network outreach events, and just listed as some additional outreach as well that we've done on our own to try to build the volume for the clinics. We could go to the next. Okay. So this is our SWOT. So highlight just as far as our strengths. I'm super proud of both the teams at the clinics. They've been able to average a 96% customer service satisfaction rate through the surveys. Part of the way we've been able to do that is making sure that all staff have access to the written surveys, as well as all staff has the QR code in their offices, and the QR code is also posted in the space we use for group rooms. So that everybody's able to, at some point, put in a survey. We've had a high engagement with return appointments, so less than 17% between both clinics. We're currently offering groups and individual therapy, and we have no current wait list. So as part of the strength, we do have, it's not listed there, but capacity to grow and still take on new patients. A weakness, and I'll just highlight, is we do also take walk-ins, and we do get referrals, but we do take walk-ins. So that means a patient is able to come in when we're open at any point in time and connect to services the same day, if that's what they choose to do. However, sometimes with the walk-in process, we may get 6, 7, 8 per day at the same time. If coincidentally everybody likes to come at 11, I don't know what it is about that time, but everybody will tend to come at that time. So wait times can be a little long for that. So we're just looking at ways that we can overall restructure to make the wait times less when it comes to that walk-in. We can go to the next. So opportunities, being new to the network initially, we were getting to learn all of the providers and what was within the network. I think since this first year, we have had the time to really learn about all of the agencies and what they provide, and be able to educate the staff on how they can make appropriate referrals if somebody may not be appropriate for us, or there's a service that that patient can benefit from in addition to working with us. So some threats, I'll speak about North Fulton. So we do right now spacing for us. So we do have capacity to grow, but we have limited spacing with that. Also, we've seen an increase, I think another provider said, in regards to just overall patient acuity since the pandemic. Oftentimes we get a lot of walk-ins that come in crisis. And so we're kind of doing a lot of breaking down barriers, and the increase is just a high demand for the amount of staff that we may have for the day. We'll go to the next slide. So I'll talk about a patient success story. I'll just highlight, especially the second one. She had been out of care for about a year, so she had had no mental health services for a year. She started with us in May of 2023, and she found out she was pregnant shortly after getting into mental health services. She also became homeless throughout all of that. Proud to say she is an active member in treatment. She comes every day to groups. She has had her baby. She had a baby this month, actually, and she's still trying to make it with her and her child. So I think that was just a phenomenal story. And that's it. Thank you.
Thank you, Grady. Thank you for partnering with us. And I will also add that Grady is a partner, as Pat is coming up, that Grady partners with Fulton County in reference to the medication assisted outpatient treatment as well. So that is also a program that Grady provides in the community, and Fulton County is a proud partner with Grady in providing funding for that program. It's on you, Pat. Thank you for your patience.
Oh, thank you. Hello again. I'm Denise White, the Deputy Director at PAD. PAD stands for Policing Alternatives and Diversion Initiative. And I'm going to give a brief program overview, and then our Director of Social Services, Letitia McCall, she'll give you a deep dive into our 2023 data. So we were established in 2027, and there are core components to our, 2017, I'm sorry. I've been suffering insomnia the past few nights. So we were established in 2017, and there are core components to our program. First, we have a partnership with ATL 311, where anyone in the community in the city of Atlanta, if they find that they observe someone who has quality of life issues related to unmet mental health needs, substance use, and or poverty, that person can call 311 and we will have immediate community response. So we'll go out to the scene and we'll provide support and services to that individual. And also we work with law enforcement, and they can refer someone to our program if anyone's committing a law violation that's related to those unmet needs related to substance use, poverty, and or unmet mental health needs. And I can go on about PAD, but I know we're short on time and I want to be mindful of that. So I'm going to just hand it over to Letitia, and she's going to talk about our 2023 goals. Thank you.
Thanks. Oh, and thank you for putting it back to that slide. So I'm just going to briefly go over everything we did for 2023 at a glance here. Keep this under the next couple of minutes. So we had 264 diversions last year, and I want to highlight our response time is 23 minutes, and we respond to all 6 zones. So the response time is actually pretty cool. And then, all right, I'm going to walk up. I tried. Got it. There we go. Okay, so we've had 725 successful engagements. And that's really half of our response requests. So everyone who's calling into 311, we provide direct services to those callers right then for what they can do, if that's what it needs. And if we need to go out, we do go out, and we've had 725. So half of those response requests, we were able to go out and meet those needs at that time. So our top demographic are Black people, Black men above the age of 25. So that 25 to 40 and that 41 to 60 range is about evened up there. We do have some people in their 60s and above. We start working with people at 17 and a half, because what PAD does is we are 100% consent based. So we have to have people who can consent. So we start at adults. The main services that we provide are food and outreach. And then I want to highlight the transportation assistance there because we're a connection agency. So we send people to a bunch of different places and we don't just kind of like just send them out the door. We set appointments for them. We grab our vans, we take them to places, we put them in Ubers, we give them water cards. So we're not just setting up appointments and hoping they get there. We actually really provide that transportation support. Oh, we go to the next one. In our community outreach, okay, this successful engagement shouldn't be there. I'm sorry. We had 312 Atlanta businesses engaged last year. And then our community outreach team put on 5 Atlanta community events. This is one of them where we introduced what we do and how we do it to a bunch of people that day. Something else for the community outreach, just want to highlight our new location. We're located at St. Vincent de Paul's old building. And in there, we actually centered in zone 3 and people are able to walk into that space and receive services. So we can't necessarily enroll them in PAD because we have 3 points of entry, our lead diversions, post-booking diversions, and 311. But people can come in and access food, access how to get to the next spot or where should I go for this thing. So we're able to provide those types of things to people. Next one. So the program that we work with Fulton County is our COSAP program. That is our substance use treatment. We're able to refer a bunch of people to a bunch of different places for treatment. And I just want to highlight that most of our demographics really looks the same as our general demographics. So we're pretty representative there. We enrolled 47 unique individuals. Of those 47, 2 last year experienced rearrest, but we were able to refer everyone to some type of treatment. 33 of them were placed in treatment housing, and then 14 people received outpatient treatment. Now, while that number equals 47, some of those actually do overlap. And I haven't really dived into the data to figure out how that is because the number is still equal and it should not. It should equal more than 100. I mean, more than 100%, but I'm going to look into that more. Our progress. So we've been able to permanently house, of those 47, we were able to permanently house 7 people. 9 of them are currently employed. 4 of them are connected with our SWEET team. That is our Street Wellness Enhancement and Engagement team, our more clinical case management team. Our documentation status, documentation status. So 36 people have received all the documentation, so birth certificates, so security cards, things like that. And 36 are in progress. 11 of them have received all of their documentation. And then our participant status, so 24 of our 47 are still active. That means that they are currently working with their case managers, their care navigators. 5 of them are in outreach. So outreach is they have not had contact with us in at least 30 days. And inactive, those are people who haven't had contact with us in at least 90 days. So PAT does not necessarily discharge people. We know that the recovery journey looks a little bit like this, and we respect that. So people can always come back to us when they need to, and even when they're advanced. So advanced means that they've met their goals. They can still come back if anything comes up. Our SWOT analysis. This is more of a broader overview, but there are some things that I want to dive into a little bit, but not too much. Our strengths, the pre-accusation diversions from Fulton County. So we want people to be diverted for any things that they could be diverted for. However, past hours are 7 to 7, Monday through Friday. So there are people who miss that, and we're able to kind of catch them at the pre-accusation project. And that project means that we can get referrals from people who have divertible charges before they're actually booked. If that happens, we get the referrals, we go into the jails, we screen them to see if they want PAT services. We screen them to see what we can do for them. And then we make the recommendation that those charges should be diverted and that we can work with them. It's still 100% consent-based, and we let people know that. We let the judge know that, who isn't like the, what do you mean you're gonna get people out of jail and then what, right? So we do run into that a lot, but we still advocate that these are divertible charges, that people should not be arrested because they are poor or having a mental health crisis. So I just wanted to highlight that. Sorry, I'm just one from each. What some of the weakness are pre-arrest diversions leading to more bookings and not enough recovering housing and peer support. And I think many of us named that as well. Opportunities. So the Center for Diversion Services is coming on, and Fulton Behavioral Health Crisis is coming too. So we'll be able to refer a lot more people to those things and to give people immediate help when we can. And then a threat is the jail overcrowding and underutilization of diversion services. Our staffing, so our direct staff, we have 15 care navigators, 10 community responders, 3 community outreach specialists, and 6 suite advocates. The suite team is made up of 3 pairs. So each team has a clinical advocate as well as a peer advocate. And then the relevant management and leadership, the care navigator supervisors, suite supervisor, legal and housing managers, myself, and the executive director. We have a more extensive management team, but I just listed the ones who are directly involved with this, and our deputy director, Denise. And I want to highlight a participant success. Talk about Bill a little bit. He was diverted in April and started working with his care navigator. They were able to get a bunch of things done in a very short amount of time. And honestly, he really couldn't believe it. And he was like just excited about what he's been able to accomplish in just a little while. He worked more with her, and so while he was in treatment housing, he got a job across the street at Walmart, and then he just moved into his own house, his own apartment in December. So I want to highlight that, and I'm gonna back up again so you all can see the quote. But he sent his care navigator this text message just kind of thanking her for all the work that he was able to accomplish. And I know you probably can't see that, and I've backed up now, so I can't even read it to you. But basically, he just kind of explained to her and sent this screenshot to me, letting me know like that he was just so excited about what he's been able to accomplish. He couldn't believe what he was able to do in just a short amount of time, and thanking Pat for what we did. And that's what I have.
Thank you. Thank you all. I mean, wow. I know we ran over time today, but everything that was shared was very important. There are a couple grants that we currently have within our department. And we will save all of that information for a later date. As mentioned, the Behavioral Health Crisis Center should be coming online this year. Fulton County's partnership with the City of Atlanta on the Diversion Center. So there are a lot of great things getting ready to happen in 2024. There are great things that have already started happening in 2024 because of our partnership with each one of you that creates the Fulton County Behavioral Health Network. So on behalf of the Department of Behavioral Health and Developmental Disabilities, I first want to thank our Board of Commissioners, our county manager and executive leadership, and each one of you that represent the Behavioral Health Network, because without you, we wouldn't be able to provide the services that we provide. And this definitely demonstrates that it takes a village, and we've gone back to the basics, right? And we've created our village, and we're strengthening our continuum of care, and we will continue to pursue bigger and better things. So thank you all. Because of you, this is possible. And I look forward to our next presentation at some point late summer of 2024. Take care.